Transmite en su canal de frecuencia modulada estereofónica multiplex La Voz Radio, desde New Haven, Connecticut, al mundo.
Buenas tardes. Good afternoon. My name is Caprice Taylor Méndez, and here we are with Together We Can. And as always, when you hear Spanish, do not turn that dial because our show is bilingual. Gracias por estar aquí con nosotros. Mi nombre es Caprice. Es un placer estar de vuelta con ustedes con Juntos Podemos, donde celebramos co-creadores de un mundo más justo y más gentil. Y hoy tenemos con nosotros dos personas muy importantes para la salud de nuestra comunidad. Y ellos tienen un gran mensaje que lo más importante para la salud es nuestra comida. El tema de hoy es comida, nuestra medicina. Y no quiero cortar el tiempo con lo que nos tienen que contar hoy. Por favor, no cambien esta sintonización. Estamos en vivo desde New Haven en 103.5 FM WNHH en La Voz Hispana de Connecticut. Y si les interesa repetir este programa de hoy, pueden llegar a la página de Facebook. And so, as always, it is a great pleasure to have with us co-creators of a kinder and more just world. And I don't want to take up our time today by you hearing my voice. I'd rather have you hear our two wonderful guests straight from Haven Free Clinic. La clínica gratuita se llama el programa de nuestros personajes de hoy. La clínica gratuita en New Haven. And the Haven Free Clinic is based out of the Yale Physicians Building. And it's a cadre of people with big hearts who have dedicated themselves to supporting the well-being of our community here in New Haven. Making sure that people who are uninsured are not turned away from the medical care, the time-sensitive medical care that every human being deserves. And I haven't had the opportunity to talk with our two guests before, but let me tell you, in the time of COVID-19, and some folks might not be aware of, but those who were, know Haven Free Clinic from the mutual aid activities that were going on. People were scrambling to make sure that no one was suffering when someone can help. And mutual aid in New Haven showed up where trying to connect people to resources, and where resources didn't exist, someone volunteered to fill that gap who had those skills. And that is what I heard happen with Haven Free Clinic. Uninsured folks, folks who did not feel comfortable walking in through Yale or any other community setting, and knew that they would get turned away because they didn't have access to insurance, or they lacked enrolling for it and not know that they actually did qualify for insurance. Haven Free Clinic, students at Yale for nursing and nurses, actual doctors and pre-med students, mental health providers raised their hand and said, "What can I do?" And so it is a pleasure to have the Free Clinic with us today, Haven Free Clinic, Jason Weinstein and Katrina Dietsche. Thank you both for being here with us. Tenemos con nosotros Jason Weinstein y Katrina Dietsche, que esta clínica gratuita estaban sumamente ocupados en apoyando a la comunidad, especialmente si seres queridos de la comunidad que no sabían que podían tener seguro, conseguir seguro médico, o no podían conseguir seguro médico. Esta clínica estaba sumamente ocupados en apoyar a nuestras comunidades aquí, especialmente en New Haven, durante la época de la pandemia, y eran puros voluntarios, estudiantes de medicina, de enfermería o enfermeros o doctores, que tomaron de su tiempo para hacer aquí estoy presente, qué necesitan de mí para apoyar en la salud de nuestra comunidad aquí en New Haven. Y tenemos con nosotros Jason y Katrina. Welcome.
Hi, thank you so much for having us today.
And so, what a pleasure to have you. And cutting through the chase, food is medicine. Wow. If we were to really take to heart what that means, why are we eating processed chips? Why are we eating processed cereals with food colors and sugar? What does this mean? Food is medicine. Would that change? El tema de hoy que la comida es medicina. ¿Y cómo cambiaría? Uno come cereales, se lo da a sus hijos con coloreantes para que se vea más vibrante, rojos, verdes. Uno le da comida a los hijos que es mucho más barato, comida procesada, que comida fresca. Pero ¿cómo cambiaría la situación si tomamos en cuenta que la comida es medicina? So, can you share a little bit more?
Yeah, no, I think that's a great question. And again, thank you so much for having us here today. But I think something that we thought about as when we started this Food is Medicine initiative is some of the things that you just mentioned about the ultra processed foods that we see in everyday supermarkets that are cheap and easy to obtain everywhere you go. But when you look at fresh, healthy groceries, those are usually harder to find, or when you do find them, much more expensive. So I think something that we really wanted to focus on by starting this initiative is recognizing how hard it is for the average person right now to find healthy, fresh groceries for whatever reason possible. And with that, acknowledging that, removing some of those barriers for patients when they come into a free clinic to receive healthcare, if they do screen for food insecurity in some capacity, in some way, that we're able to meet them where they are and get them the groceries that they need for themselves and for their family members.
And so at the Haven Free Clinic, you screen people for how do you feel? How does your body feel today? What's going on? And what is your situation with food? Are you able to access readily fresh veggies, for example? So that is part of your screening, you're saying, from the onset.
Yeah. So that's something that oh, sorry, Katrina, after you.
No, yes, that's exactly right. So when patients come into the clinic, we want to make sure that we're not just thinking about the specific disease they come in with, but all the things in their environment that are affecting that disease. So, for example, if a patient has something like diabetes, that's a condition that's highly dependent on what type of food a patient is able to access. So we want to make sure we ask if these patients can get a hold of these healthy food items that will help their disease progression. And if the answer to that question is no, being able to actually provide them with those healthy food items that can improve their state so wholeheartedly.
Beautiful. It sounds like radical medicine, but yet it is so practical and just so closely tied to the human body. If you have diabetes, your food intake, how you manage that and stay healthy is so critical. So I'll just translate what was just shared. En la clínica gratuita, que está ubicada aquí en New Haven, asociado con Yale, y todos son voluntarios, dicen que cuando una persona viene y está buscando asistencia médica por algún síntoma que tienen experiencia en su cuerpo, lo primero que hacen, no solamente quieren diagnosticar qué es lo que le está pasando a la persona físicamente, haciendo las preguntas típicas, qué es lo que sienten, dónde siente el dolor, el cuerpo, qué está sucediendo. También preguntan si tienen acceso a comida fresca, especialmente cuando ven de que esta persona está sufriendo por algún síntoma de alguna complicación crónica del cuerpo, y directamente asociada también con lo que uno come. De allí de seguro preguntan si tienen acceso a comida fresca. Por ejemplo, en el caso de una enfermedad como diabetes, es importante tomar en cuenta las situaciones ambientales, la situación de la vida cotidiana de esta persona y especialmente si tienen acceso a comida fresca, no procesada, no comida que está procesada, pero que uno tiene que lavar los vegetales, limpiar los vegetales, pelar los vegetales. Uno hace el trabajo y no simplemente papitas en bolsa. Las papitas en bolsa no es igual que papas frescas que uno tiene que limpiar, lavar, quitar la tierra. Es decir, hay una gran diferencia de comida procesada y comida fresca. Y ellos, si notan que la persona no tiene acceso a comida fresca, como dijo el señor Jason, la comida fresca muchas veces cuesta mucho más y hay veces que para una familia o una persona es difícil obtenerlo. Y en esta clínica quieren romper las barreras y proveer la comida fresca a los pacientes como una prescripción, una receta del doctor y directamente impactar a la salud de la persona, ayudar al cuerpo a estar sano. And so what I'm hearing is much like a doctor gives a prescription for here, take this pill, you have diabetes, take this injection, if that's the right type of diabetes, for injections to monitor your glucose level and make sure you don't fall into coma. What I'm hearing is food is the pill. And so, do people actually walk out with a grocery bag, or how does this work?
Yeah. So I mean that's the great question, and I think that's something that as food is medicine initiatives are popping up across the country, I think looking at food as the prescription, as something that is so fundamental to our health, I think that's something that's becoming a new focus and finding ways to focus on these healthy groceries instead of looking at these really expensive treatments like pills and injections in the future. So I think that looking at it like a medication is something that is really important for us. And I think something in terms of how patients interact with the Haven Free Clinic. So patients will come in, and we kind of mentioned this prior, but they'll come in for their normal health appointments, maybe a physical checkup or coming in for another disease that they're looking at or another condition they would like to have treated. They'll go through a screening procedure that we talked about, and then they're referred to our department inside the clinic. And from there, they're allowed to grocery shop. They can pick up different grocery, like vegetables, like spices, seasonings, fruits, meats, like fresh produce that's usually very hard to find at times. And then after their appointment is over and they're leaving the clinic, we help them to their cars or to the bus stop or even to the front door if they're walking home. But they'll walk out with a bag of groceries that will hopefully provide them 10 to 15 meals that they'll be able to provide for themselves or for their family members in their household, if that's something that they're interested in sharing.
Phenomenal. And I love what you just said. Also for the family that they live with, the community that they live with at the home, because that also reinforces healthy eating habits where if you want to eat healthier and somebody else's you can't have that right now because you want to get healthier, it's harder for someone. But having the whole household family go through the same process makes it even better for all involved, actually, not just the patient. So that's wonderful to hear. I'll just translate to Spanish. Jason dice de que en la clínica gratuita ubicada aquí en New Haven, cita con el doctor regular, el examen anual, por ejemplo, o seguimiento, dando seguimiento a I'm sorry, there's a little bit of static from Katrina's phone. So if you don't mind muting, Katrina, that would be great. Thank you. Que si están dándole seguimiento a con su condición con el doctor y entran con la cita y de ahí ven que la receta, en lugar de dar pastilla o inyecciones, es la comida como una receta del doctor. De ahí, precisamente antes de salir del edificio de Haven Free Clinic, ahí pueden ir de compras, conseguir su comida, vegetales, comida fresca, lo que uno quiere para sazonar su comida, fruta fresca o carne fresca. Ahí mismito pueden hacer sus compras para 10 o 15 comidas para sí mismo o para compartir también con la familia. Yo estaba diciendo que es más fácil mantener seguimiento con la receta de comida, comiendo más saludable si es compartido el proceso, el cambio de comportamiento en cómo uno prepara su comida con toda la familia, para que de esa manera uno no siente un disgusto, como si hay un sacrificio, mientras los demás pueden comer lo que quieran. La verdad que el cuerpo del ser humano es igual para todos. Hay una ciencia en cómo mantener cuerpos saludables, y si uno no está consumiendo bastante azúcar, bastante carbohidratos, para calcular bien a que uno no se enferme peor con diabetes, también puede ser que los hijos, para prevenir a que ellos no tengan diabetes, es bueno para invitar a la familia a compartir en el proceso en comer más sano. And to your point, in including the family, it actually also can prevent, for example, one's own children from acquiring, for example, diabetes or chronic health condition. And so inviting the family, even though they didn't get the doctor's prescription, and trying to limit carbs and limit sugar intake, for example, in the case of diabetes, it's a good thing to start children on the right path to eat healthy. Why wait until they have pre-diabetic symptoms? And so here in the US and in Connecticut, there's actually, 1 in 10 folks are close to being diabetic. So they're 1 in 10 are pre-diabetic. It's a big number. So this food as medicine, what portion of our community in New Haven would this help? Como a qué nivel en nuestra población, en nuestra comunidad, si tomamos en cuenta la comida como receta, ¿a quién le funcionaría la comida como receta para tener mejor salud? So what proportion of our community would actually benefit from food as medicine?
Yeah, I know. I think that's a great question too, and I think taking a step back and looking at some of the national trends might be helpful as well. It's like starting in 2021 to 2022, there was a 3% rise in food insecurity in the nation, which now would encompass about 44.2 million people, which is some of the highest levels that we've seen. And that's because of two main reasons. One is because inflation, groceries have never been more expensive. And then two, a lot of the COVID era tax credits that a lot of families were able to benefit from, that were able to supplement their incomes and spend more on food, actually were rolled back in 2022. So a lot of patients didn't have that. And since then, those policies have not been replaced. So a lot of families are still struggling when now the prices are higher than ever to meet those nutritional needs that are so important for their own development, but also the development of their children or anyone else that lives in that household. Now, that level is only exacerbated when you look at Connecticut. That 3% increase across the nation is actually a 7% increase in Connecticut, which represents about 612,000 people. And then more harrowing is that rise from 3% for the nation, 7% for Connecticut, is actually up to 22% in New Haven County. So when you look at all the needs in terms of people struggling with food insecurity, here in New Haven, it has never been more high and never been more important for initiatives like Food as Medicine, like some programs that can provide additional food assistance in the greater community area to help and supplement some of these households that are struggling to meet these needs. So now is more important than ever to have initiatives combating these food insecurity, as well as these metabolic chronic conditions that a lot of Americans and individuals in Connecticut are facing.
Thank you for that sobering set of facts, Jason. And it makes me think of food insecurity. It basically comes from you can't afford to buy food, and oftentimes the cheapest food are the processed food. So it only increases the intake of processed food versus hearing, close to 1 in 5, 1 in 6 people in New Haven are food insecure. That's a lot of processed food that people are buying to try to sustain themselves, but increasing chronic health conditions and increasing health problems that can lead to hospitalization and loss of employment and all of the difficulties that can ensue if we can't operate in our full capacity as in our human bodies. It really causes a lot of chaos and expenses for all of us, meaning more people, depending on emergency rooms, we end up paying more in healthcare as well. So what you're saying is having a grocery store inside of a health clinic, your doctor's office, is actually saving us all heartache, saving us all in our pocketbooks as well in Connecticut.
Yeah. And I think just one more thing that I think you touched on, which is an amazing point, is that I think a lot of the rhetoric around the health in America that's perpetuated by a lot of big farm like big pharma, and also like a lot of the food store chains, is that the reason why people are suffering from chronic conditions is because they choose to eat unhealthy products. They choose to eat ultra processed food. Well, in reality, like you're saying, a lot of them are just cheaper, more readily available for a lot of individuals that are struggling to make ends meet. And so hopefully what we're doing with the food pharmacy, and a lot of other people in New Haven and Connecticut are doing as well, is they're reframing the conversation. So it's not just blaming individuals for bad choices, but in reality, looking at it's a matter of access and who has access to buy healthy groceries and to provide for themselves and their families. So hopefully we're contributing to that changing narrative as well, taking the burden off the patients and looking at the systems in place that are putting people into this box.
Oh, phenomenal. I'll just translate, and then I'd love to hear from Katrina as well. Quiero traducir. Jason dice de que lamentablemente a nivel nacional en los últimos años ha aumentado inseguridad de comida. A nivel nacional ha aumentado por 3%, pero cuando uno ve los números aquí en Connecticut y en New Haven precisamente, mucho más alto. A nivel de Connecticut, a 7% ha aumentado inseguridad de comida, y para New Haven 22% de nuestros hogares tienen inseguridad de comida. Eso quiere decir de que no saben si van a tener comida el próximo día, que no están comiendo 3 veces al día, o peor también que aumenta el consumo de productos procesados, porque todos sabemos de que cuesta menos comprar una caja de pasta que comer frijoles frescos, tomate fresco o comida fresca, vegetales, espinaca fresco. Es mucho menos comprar comida procesada de una caja. La mayoría de la comida procesada es lo que está en una caja. Si hay una caja con ingredientes con nombres tan largos que uno no lo puede pronunciar, probablemente uno tiene en su mano comida procesada. Para los quienes tal vez muchos de nosotros puede ser que eso nos olvidó, que es la diferencia de comida saludable y comida procesada. Y si esa caja tiene ingredientes que uno no puede pronunciar, y bastante de ellos es probablemente comida procesada. Y eso quiere decir casi 612,000 personas aquí en Connecticut no tienen acceso a comida fresca, no saben cuándo van a comer el próximo día de tener un buen plato de comida saludable. Y los farmacéuticos les gusta decir que es que la gente están tomando malas decisiones y nosotros vamos a proveer medicina en pastilla para ayudarlos. Y lo que mucha gente no reconoce es de que uno comienza a pagar por comida procesada porque ve que cuesta menos. Cuando uno va a pagar en el supermercado, anota de que cuesta menos comer comida procesada, pero lamentablemente uno termina pagando más porque ahí vienen las condiciones crónicas de salud que en lugar de comer una manzana fresca, está con galletitas para el almuerzo de su hijo en la escuela. Y lamentablemente ese es el progreso de problemas crónicas como adultos. Y es importante tener acceso a comida fresca. Y por eso la clínica de Haven tiene un supermercado para sus pacientes. Y uno termina pagando más como una sociedad, pagando para el vecino que está comiendo comida procesada y termina llamando a la ambulancia, yendo al hospital de emergencia y no tiene cómo pagar por todo eso. Mejor invertir a que nuestros vecinos comen comida fresca y invertir los dólares para prevenir complicaciones crónicas con comida fresca. And so, Katrina, can you share with us what message would you love the audience who are listening to the radio show to walk away with everything that we're talking about? What is that one thing that you want to make sure that they remember after today's show? ¿Qué es lo que, Katrina, deseas que el público se recuerde del programa de hoy?
Yeah, thank you so much for that question, because I think that one thing I would love for people to know and remember is so often that these diseases like diabetes and obesity and high blood pressure are thought of as diseases of excess because of the way they're stigmatized in our society. But so often, and more often than not, there are diseases of not enough. There are diseases of not enough affordability in the grocery store, not enough time to get off of work to prep these healthy meals that can fuel our bodies and keep us healthy and keep our families healthy. And so I think that I hope that people know that these programs are growing and that we hope to start making those connections between the access to groceries and safe and affordable housing and all of these social determinants of health are brought more closely into the clinical setting, so that when people come into the doctor, we're not just thinking about the disease they have, but also how we can support them in all areas of their life. Because ultimately, food is a human right, and healthy and enjoyable food is a human right. And we're so thankful to be able to take one more step closer to making that a reality within the Haven Free Clinic.
Beautiful. Beautiful, thank you. Nina va a terminar en 2027 porque es un gran esfuerzo ser practicante de medicina acá en este país y no solamente está estudiando, pero también aprovechando el tiempo aquí en New Haven para apoyar nuestra salud comunitaria. Mil gracias, Katrina. And I just added, before I translated what you shared, that you are a student of medicine due to finish in 2027, and it's a laborious process to complete med school and become a doctor. And in the time of the laborious, intense process, you're also volunteering in service to New Haven's community and already having an impact on our collective health and well-being. So I just want to say thank you. And now I'll translate what you just shared. Yo le pregunté a Katrina si hay algún mensaje que sería a que nosotros nos podemos recordar después del día de hoy en esta programación. Y ella dice que quisiera que todos reconozcan que no es solamente las decisiones que uno toma, la causa de obesidad o en tener presión alta o diabetes, estas condiciones crónicas, porque también tiene mucho que ver las condiciones sociales. Si uno tiene un hogar, si uno tiene suficiente dinero para comprar comida fresca, para poder escoger comida que sea más saludable. También si uno tiene tiempo para cocinar. Hay mucha gente que es más fácil recalentar comida ya preparada o echarle agua nomás, ponerlo a hervir y ya tenemos la cena, ya tenemos el almuerzo. Pero lamentablemente en no tener tiempo para cocinar y preparar la comida en casa, también comprar ahí, ni salir del carro. Y uno pide su comida en una ventanilla y ya llega a la casa y se lo da a sus hijos o uno también se lo come. Esos momentos son los que uno termina pagando. La sociedad termina pagando. Que hay muchos que no tienen suficiente para comer bien. Y nosotros... Katrina dice, en la práctica de medicina, los doctores, enfermeras, es importante tomar en cuenta las condiciones en que la comunidad vive. Si la enfermedad no es solo lo único que impacta la salud de uno, pero también acceso a comida fresca, si tienen una casa estable y saludable, eso también impacta la salud física también de la comunidad. Y es importante a que los quienes practican medicina tomen en cuenta las determinaciones a nivel social de la salud, porque no solo cuenta si están tomando la pastilla y qué es esta situación crónica, pero también todo lo demás que impacta el bienestar de las personas que uno está cuidando. Thank you for reminding us of the importance of social determinants of health. And if we truly are about reducing chronic health conditions in our community, I applaud your efforts in sharing about health practitioners need to keep in mind the social determinants beyond just the medical delivery system, and are they taking their pills or not as required, but what is their housing condition? Are they in a stable and safe, quality, healthy house? Unfortunately, in New Haven, for example, we have issues with floods already, water going into people's homes, which also increases the opportunity for black mold and asthma rates. And are there pests like creepy crawlers that actually make asthma rates even worse as well? So all of the social determinants of health, I'm just pleased to hear that it's being embraced by Haven Clinic, and your message is, hey, if we're really about supporting health, we need to take into account the conditions by which the patients have to live under. And something that I also heard about Haven Health Clinic is you live by that truth. And so the mutual aid experience, there were nurses, doctors, students in pre-med and nursing that were present in contacting elected officials, volunteers, all volunteers, folks who really understood that in order to step up into the challenge in supporting community to survive the pandemic, that it required lifting up their own voices for what they've witnessed and knowing I can't assure that my patient will be well and also keep their family safe if they don't know whether or not they will get evicted, right? So I also saw and heard medical practitioners stepping in to be a voice of reason as to how important it is to care for the collective good. And it isn't just, I'm just focused on this issue, but actually recognizing the wholeness of humanity, the wholeness of the patient. And I think that is such a beautiful quality of the Haven Free Clinic. And another place that I often hear of embracing social determinants of health are also some of our local community health centers as well. But coming out of Yale, there's a profound impact that it will have on practitioners that come from all over the country and get to witness and experience what does it look like and feel like and smell like, because you have a grocery store that's amazing in service to the actual well-being of the patients. And where did you get inspired from? Where did this concept, where was it born? Tell me more.
Yeah,
¿Cómo es que
absolutely.
ustedes estaban inspirados en hacer esta forma de comida es medicina?
Absolutely. So, as Jason alluded to earlier, luckily for all of us, these initiatives, these food is medicine initiatives, are becoming much more common around the country. And so this one was actually inspired by my time in Washington, D.C. before I moved to New Haven for medical school. I spent some time volunteering at the Children's National Hospital in Washington, D.C., and they also had a food pharmacy situated right in their pediatric endocrinology division, because in that department, they also worked with a lot of nutritionally related chronic diseases like obesity and diabetes and high blood pressure. And there I just saw the profound impact it made on patients, how much they appreciated and enjoyed the food they got to try, and how it, improved their health outcomes in the clinic. And even more so how it, created a better relationship between the patient and the doctor as well, because these patients were really feeling seen and taken care of and understood. And so when I came up to New Haven and started at Yale, Jason and I bonded early over our interest in these preventive health measures and knew the great impact that food insecurity had on patients at the Haven Free Clinic. And so that's where we put our heads together and met with some of the amazing food pantries in New Haven, including Loaves and Fishes and Desk and Haven's Harvest, to talk to them about, how we could start a program like this at our free clinic and get advice from them, and to learn how we could do this in a very equitable and community-driven way. And with all their advice, we ended up being able to start it at the free clinic and use a similar model that Children's National uses to provide these healthy and fun recipes to patients too. So they're not only getting the grocery items, but they're also getting some education on how to prepare these enjoyable meals.
Beautiful. I'll translate fairly quickly, and my question to you after I translate, Jason, will be: what are your parting words to the folks who are listening to today's show? And thank you so much, Katrina, for your leadership and visionary, just being a visionary and bringing this into New Haven and into our homes. So thank you so much. Quisiera traducir lo que dijo Katrina, que le inspiró, tener un supermercado para los pacientes con condiciones crónicas. Ella dice que ella llegó acá a New Haven desde Washington, D.C., donde tuvo la oportunidad de ser una voluntaria en el Hospital Nacional de Niños. Y también ahí ellos tenían muchos pacientes con condiciones crónicas como diabetes, obesidad, alta presión y condiciones impactadas por la nutrición del cuerpo. Y de ahí ellos formaron un supermercado dentro del hospital y ahí mismo vio datos científicos que vio el mejoramiento de salud, y estaban tomando investigación, vigilando bien si cambia, mejora o qué la salud de los pacientes, en saber de que ellos tienen acceso a comida fresca. Y sí, así fue, que han podido notar y documentar que este método mejora la salud de los pacientes y también previene complicaciones en la salud. Y de ahí fue inspirada con también asistencia de organizaciones aquí en New Haven que ofrece comida gratuita para la comunidad, como Loaves and Fishes, que si uno no tiene dinero, ahí ellos dicen: pueden llegar acá y le vamos a ofrecer comida, y también hay comida que pueden llevar a casa. Y con asistencia con los grupos sin fines de lucro acá de New Haven, allí formaron la clínica gratuita para que la comunidad pueda llegar y conseguir sus compras de gratis, y tomando en cuenta la voz, que eso que la comunidad desea comer también, que sea nutritivo, y de ahí tenerlo en la clínica. And so, Jason, we're about to end our show, but I'd love to hear your final words for our community. And please, if you haven't been able to watch the full show, but you're hearing it now, you can go to La Voz Hispana de Connecticut on Facebook and watch this video of today's show. And so thank you again, Jason, for being with us. And what are your final words for the folks who are listening?
Yeah, I think the final words I would have, and before I say, I just want to say thank you so much for having us. It's been such a pleasure talking with you today about something that I'm and Katrina are so passionate about. But I think the message that we want to get across is that food is very simple, but it's also very powerful at the same time. Our very first day of working in the clinic, there was a patient that came up to us and gave both Katrina and I a hug afterwards, and it was kind of tears were watering a little bit. But what she was saying was that she didn't really know where the food was going to come from for her child's lunch for this coming week. But after she had come to the clinic, she now did. She now knew that the groceries we were going to give her were going to be enough for her son to go to school and not be hungry. And I think that was enough to make her emotional and just want to tell us how important this was for her. But I think that's kind of representative of not just her, but of community members, both in New Haven and across the nation, that are really struggling to make ends meet and would love to have this extra security, and recognizing the power that just extra groceries can have, both for your health, for the sense of security that you feel in your daily life, of that stress weighing on your shoulders about providing for yourself and for your loved ones. And I think it's just a very powerful thing that I am truly appreciative of, and I know Katrina is as well, that we were able to meet people where they are and give them that extra bit of comfort, and that sense that there is somebody that sees them and acknowledges them and will give them that care and love that they deserve.
That's beautiful. Y Jason nos quiere recordar de que la comida es algo tan simple pero tan poderoso en nuestras vidas, y se recuerda de una interacción con una paciente y ella tenía lágrimas en sus ojos diciendo gracias por ofrecer esta comida fresca, gratuita, porque mi hijo no va a tener que ir sin almorzar en su lonchera, sin almuerzo en su lonchera cuando vaya a la escuela. Ahora va a tener almuerzo y es suficiente para apoyar a su hijo durante la semana. Y es importante reconocer de que hay muchas personas en nuestra comunidad a nivel nacional y también a nivel local que en estos momentos están pasando por un gran reto en conseguir comida saludable. Y este método de ofrecer comida como medicina aumenta la seguridad de nuestras familias, aumenta la salud de nuestras familias, y no tienen que tener esa gran ansiedad sobre su persona en cómo van a conseguir comida saludable para ellos mismos o para sus seres queridos. Proveyendo esta comida ayuda a muchas personas. Y yo nomás llamando a nuestros abuelos y abuelas, ellos sí sabían la importancia de comida es medicina. Por ejemplo, me acabo de enterar de que cuando uno come frijolitos y maíz, ayuda el cuerpo a procesar como proteína a nivel de como si uno estuviera comiendo carne. Es decir, si uno solo come frijol, no tiene la misma interacción esas dos comidas. Entonces, cuando uno come su maíz y frijolitos, es hasta más proteína para el cuerpo. Y es sabiduría ancestral que nuestra gente sabe. Entonces, no es tan simple reemplazar lo que uno puede comprar acá en este país y reemplazar la comida que nuestros ancestros han tenido que depender, y en verdad funciona mejor. Otra cosita, una tortilla fresca hecha en casa con masa y agua tiene más calcio para el cuerpo que un pedazo de pan blanco o de trigo. Mil gracias por escuchar el día de hoy. And I just shared really quickly that emphasizing food is powerful and calling in the ancestors from Latin America that understood that to be true. And I just learned scientifically, if you eat black beans separately, they have some level of protein. And if you eat black beans with corn, you actually intake, your body's able to absorb the amino acids and proteins at a higher rate than if you just ate one and the other separate. And I did not know that. But the ancients know so much. And the other thing I learned was homemade tortilla, where you have the cornmeal and you just add water. That actually has more calcium than a slice of white bread or wheat bread. And so with that, not everything that shines gold is actually good for you. So, and sometimes we think coming to a new country, getting more money and spending on pre-packaged, nice package and box with label that is actually better for you. It's actually the quite opposite. Food is simple, like you said. And going back to our roots, the closer it was to the dirt, by the time it gets to your table, that's a good guess that it's probably healthier for you. And if it's in a box with words on the label that you can't pronounce, that's a good indication that it's probably processed. So, thank you so much, Jason. Thank you so much, Katrina. And what a pleasure to have you here with us. And in the future, if there's anything else you'd like to share with the community, we are here for you. And thank you for being here for us. And so thank you all who are listening. This is Together We Can, Juntos Podemos, where we co-create a kinder and more just world. And thank you to our co-creators. We honor you today.